My name is Sanket Shah. I'm a comprehensive ophthalmologist. I'm practicing at Insight Vision Center in Fresno, California. I think Anterion is really defining the gold standard because Heidelberg itself has already made a name for itself with the spectralis, and the swept source OCT is so accurate that now we finally have a device that can do it in the anterior segment. We get crisp measurements down to the micron, and I know that reliability at the posterior segment is now at the anterior segment. It makes me feel a lot more confident in the images I get, more confident in my surgical planning, and overall just better care delivered to the patient because I have more accurate imaging. So again, the swept source OCT is really what makes the Anterion stand apart. It's so accurate, it's so fast and reliable and reproducible. I can get multiple measurements on the same patient and it doesn't change. And so I can track that over time, so when it does change, I know it's real and I don't have to question my device. Sometimes we think, was the patient sitting wrong? Was it acquired differently? But now with this, I don't have to have those questions. And so I just have a lot more trust in the device because of that. It helps a lot, and actually I have a surgical platform. I can show you a little later the views that I have, but I can use it to show the patient, this is your level of astigmatism. This is how dense your cataract is, because I have a picture. I have all of that. I have a picture of the front of their eye, which is not available on a lot of other devices. And I can show them, this is how dry your eye is, which is why we have to work on that first before we do cataract surgery. And then they can see the picture. They can see how it affects every little part because I get all that printed. And that's not something I had access to before. And now it's easy. I don't have to ask my techs to do anything else. They're still doing the same workup with the machine, but now I have the data and I have the printout so I can show the patients. The thing I love most about the Anterion is the reproducibility, the accuracy, and the fact that I get a full, thorough, comprehensive evaluation of the patient's anterior segment of their eye. It's something I like to brag about with a lot of my other friends because I know they don't have access to it. And I have all this data that comes in just one machine. So over here, the tech has taken their measurements, and this is one of the two screens I get printed. The other screen actually has the lens calculations that I need to choose the lens. But this screen gives me everything I need to see in one go. So this is my external photo, and that tells me, was it a good photo? It was clear. This is very nice. It's measured very accurately. The patient's eye is open. I have all the data I need. So I already know we have a good scan to start off. Now I have an OCT of the front of their eye, and I can see this cataract. I can see, is it super dense? Is there some problem? Is there some kind of structural issue that I need to worry about surgically? And you never had access to that before because nobody's doing an OCT of the anterior segment in typical biometry. Now I have it. Then I also get to see their total corneal power. So this is where I can show the patient, this is your astigmatism. I know, does this patient need a toric lens? Right off the bat. I can educate the patient correctly. We can talk about what lens are we going to choose. And then I get a corneal wavefront. This is again a game changer that comes from Anterion because I have micron-level accuracy with something that I did not have access to before, that most people don't have access to unless they're getting separate imaging on multiple devices. This shows me not only do we do a toric, can we do an advanced technology lens like a multifocal or an extended depth of focus. And so now in this one screen, I already know exactly what type of lens this patient is a candidate for, and I've already thought about how I'm going to counsel them. It saves me a lot of time in the room. And it tells me likewise in the other way. What if this is bad? Then I know that this patient's not a good candidate for that lens, and I can tell them this is why I think you'd be unhappy getting this type of lens, and we should do something that's going to make you happier. So that's what I love about it the most.